So I'm Avneet Arora and I'm from India. I did my med school from India and I was basically interested in primary health, preventive health. So I did my public health from UC Berkeley and currently I'm here interning at Kaiser as a research intern. So I was just searching online. So UC Berkeley has their own job portal, which is called SPA Job Site, where they have internships for Berkeley students. And I wanted to be in healthcare, which was my interest since the beginning. So I was searching for internships in Kaiser and other hospitals. And I just came through this internship and I applied, and I was just fortunate enough to get into. First, it was Kaiser. It's one of the best known hospitals in California. My interest was healthcare, so it synced well. And then the job description mostly catered to doing researches in health field, which was more important for me because I did my MPH, so I had a background in research, and I was a physician, so all of it just went well together, and it made me interested in this program. So I worked on 2 projects so far. One was assessing for implicit bias amongst family medicine residents here in Kaiser, and I was mainly responsible for cleaning the data and doing the analysis. And at the end of the projects, we mostly do presentations and make a poster. The second project that I'm working right now is the Honduras project. So it is one of the villages in Honduras called as Comayuga, and it's an unstudied population so far. It's a developing country, and Kaiser goes down like twice a year to get data from that population so that they can make some quality improvement interventions for the better health. They're trying to find out if that data helps them to find health patterns and risks of that population. So I analyzed that data and just towards the end of making a poster and presenting it. The environment here is super fun. I love coming here. I have to travel 2 hours from my place, but it's never happened like in the morning I'm like, oh, I don't feel like going. It's always like, I want to go there. It's like my first internship in US. My career started with Kaiser. I work with Dr. Rabani, who is my project manager, and he's super friendly. We can go to him like with any questions, and he is so welcoming, happy to answer them. I worked with Dr. O'Connell, who is the residency program head. I worked with Dr. Stecker, who is just smiling whenever you meet her. It's like even if you are having a bad period, if you look at her, you just start smiling again. I worked with Dr. Fangsakita, who has a brilliant mind when it comes to coming up with innovative ideas. Who else? That's the only people I worked with till now, and my colleagues who have been super helpful throughout. Yeah, that's it. As I did my med school, I did my public health internship for more than a year, which made me more inclined toward preventive health, because India is mostly a country where most of the diseases are preventable, and that made me more interested into public health. I wanted to do preventive medicine too, but just because I got through Berkeley, I took that path first. And currently, I am going to prepare for my US medical licensing examination steps so that I can take my preventive medicine ahead and pursue it. So definitely doing research is here, knowing more about how quality improvement mechanisms at Kaiser work, knowing more about how Kaiser takes care of their patients, uses their data to keep on improving their qualities that they give them, trying to make new interventions for the patients at Kaiser. So many quality improvement programs going on in every residency year where we be a part of to do the researches for them. Definitely would help me further when I take care of my patients. The best part about this internship was you get to do so many things here. the versatility of the opportunities that have been here. We have been used to data cleaning, data analysis, sorry, doing GIS, which is the spatial analysis of Kaiser's data. So there is so much to do here that you cannot fall short of opportunities. There is so many researches being done here that you cannot run out of jobs. It's like, it's been so amazing here. This has been my first internship in my career. Kaiser was the first place I gave my first life interview. And I was so fortunate to get in here. It was like my dream place to be in one of the California's best hospitals. And I'm so fortunate to have been working with Dr. Rabani, who has been my project manager. It was a great experience, made some very great memories here, and I think this has been the best part of my life so far.